Good afternoon, everybody, and welcome back to Avarian Insights. I'm your host, Patty Strolla, and I thank you for joining us for part two of our conversation on healthcare governance. In our last episode, we focused on what governance really is, and just as importantly, what it is not. We talked a lot about why governance is often misunderstood as bureaucracy and why decision rights are so hard to um, get right in healthcare. Some of the warning signs that governance is quietly failing, even when everything looks okay on paper. Today, we're going to shift from definition to application, and we're going to explore how governance actually works inside healthcare systems, how decision rights are designed, where organizations most often stumble, and what it can mean to treat governance as a system rather than a meeting. One of the biggest topics of today will be moving from a centralized control to more of a federated model. It's one of the hardest but most important leaps that a healthcare system can make. And joining us today, I'm thrilled to welcome back our guest, Madelaine Yue. Madelaine is a healthcare strategist who brings clarity and persistence to complex transformation efforts and helps executives really turn big ideas into meaningful and sustainable change. Madeline, welcome back to Varian Insights, and let's pick up the conversation where we left off last time we talked. So, today, as we move from definitions to applications of governance, let's talk about how you design decision rights that actually can work with inside a healthcare system.
That's such a great question, Patty. When you think about decision rights, they really work when they follow accountability and expertise and not hierarchy, right? When you think about how it gets kind of muddy and convoluted, it's when there's not a good structure. It's really the confusion comes out of structural issues, not people problems. So when I think about that, I think of, every decision should have a clear owner. It should have input roles, who are the right stakeholders, who are the right folks that are going to be impacted by that decision that needs to have input into that process, and a clear escalation path. When you don't have those elements defined, when you don't have a good structure, that's when it starts getting compromised and things just become kind of like a little bit more unruly. I think is the right way to say it. So I think when I think about how to diagnose that, I think, if decisions escalate just to be safe, you know, oh yeah, I'm not sure. So we're just going to escalate. That's kind of a
Mhm.
sign of an immature governance.
So, if we think about those major decision categories like strategy, policy, prioritization, standards and exceptions, even resourcing, where do organizations tend to stumble the most?
That's a really good question. So I think I mean resourcing is very much a pain point in healthcare in general. We're always trying to drive a strategy. We're trying to respond to regulatory challenges. We're trying to respond to financial challenges in the world, but we have been limited in healthcare around resources for so long. And so there's only so many things you can do with the existing resources. And so that's why prioritization is so important. So I actually think of them as very woven impacts that feed that decision process. So if you don't have a clear strategy, if you don't have clear goals for your organization that are disseminated, and goals can be defined at the highest level. And then within that, when an organization understands what those goals are and understands their roles in relation to driving that success for the organization, they can define within their line of business the goals that feed up to accomplishing the organizational goals, right? And then you start breaking down into that the element of kind of now what's the actual efforts that we're trying to support those initiatives to accomplish, kind of tied all the way up to the strategy. But then when we're thinking about those initiatives, there's two things. Does it align to the strategy? And then do we have the resources to accomplish that? That could be financial resources, that could be human resources, human capital for that, and also system resources to accomplish it. So there's three levels of resources really there. But all of those interweave in order to drive proper decisions, right? If you don't understand those different factors, it's very difficult to accomplish the goals of the organization. And I think you called out the word prioritization in that.
Hmm.
That's where the constraining factors, again, the resource components, need to be understood in order to prioritize appropriately. So if you have an initiative that is not aligned to strategy, that's an easy one to decide as, okay, do we have capacity for this? Probably not. That's a really nice to have thing, but not really a need to do thing. Versus, it's aligned to strategy. It also has a regulatory component, and that creates an urgency level. So now we have to prioritize to make sure we have the people and the technology to be able to support doing that. So it really goes hand in hand. It's very hard to separate those when you have a mature governance. It brings all of those components together to define how you make your decision.
Thank you. Thank you for that. So, to kind of restate what I heard you say, you can't take any of those components independently. You've got to have enough focus on the resourcing, but from that resourcing, as long as it dovetails into your strategy and your prioritization, then you can go forward and build your policies and your standards and document those exceptions.
Absolutely. Absolutely.
So we hear all the time in organizations about a governance meeting or governance committee. I sit on this governance. Is governance a meeting or is it a system?
Oh, that is a really great question. I think of governance as really a system. Meetings are an interface. It's how people come together to have dialogue. It's almost a tool within the process, right? But governance itself is an operating system. It's the rules, it's the decision rights, it's the triggers, it's the feedback loops that allow you to create the decisions that align towards the organizational goals. If governance is only in the meetings, it's already too late. That means the discussions, the evaluation of whether something is the right thing to do, those elements aren't happening organically within the organization to provide the right context in the meeting. So the meetings really should be the point where you're summarizing it's almost in healthcare, they use the term SBAR all the time, right? That's a great structure for it because it summarizes what's the situation, what's the background, what's the actions possible, and what's the recommendations, right? And so, or the assessment, sorry, what's the assessment and then the recommendations. And so it's like that's what I think of the meeting as. The meeting is the final, everyone's kind of brought the research together, brought the input together, and now we're going to discuss kind of where does that decision land based on the information in front of us. So it shouldn't be an area that we're going into all these questions that drive us into massive research elements that didn't already exist. It really should be the endpoint so that we can quickly and effectively come up with the decision on where that fits in the priorities and how we're going to commit the resources to be able to execute. Or the decision might be, nope, that's not the right thing to do right now.
So if we hang here for one more minute and we talk about when governance it becomes systemic, what actually changes within an organization?
Oh gosh. I love that. So I think some of the stuff that happens in mature organizations, since we started the question with the meeting component, the meetings are going to shorten, right? You're not going to end up with the thing that some of us have experienced. I'm sure Patty, you've experienced this when you come into an organization, the hours and hours and hours of meetings, back-to-back meetings, and no actual time to do the work, right? And so when governance matures, the focus is on the work and the meetings are really shortened and the decisions are much faster. So you're going to have that speed there. If it only shows up in the meetings, then it's already too late because you're gonna just be in meeting paralysis and discussion paralysis. So I think that's an important piece when you have a system structure. You're also going to have kind of elements around an understanding of what can be done outside of the higher level meetings, right? So, I think I was really reflecting upon this, and thinking about I know later on we're gonna dig into a little bit more around federated structures. I mean, that's something that we wanted to get into today. So I like thinking about that, and I might pull that up forward right now just because I think it flows nicely with where you're going with the systemic, governance and what it looks like. In a federated structure, it's very clear on, what an individual line of business does, right? It's very clear on the intersections between lines of business and then what the organization has. So the organization creates the guardrails and it creates the defined, vision on the goals that they have in front of them. It defines kind of where the decision rights are. But if something is presented, like if we say, you know, inpatient nursing, they're working through a challenge that they're having, and it's specifically around handoffs between nurses within the inpatient environment, and they want to change the process or find a more streamlined way of communicating those handoffs between shifts. Yes, they need to coordinate with IT because there's potentially a technology solution, but still the process that they're impacting is specifically within inpatient nursing. They do not need to go further up the chain within the governance structure because it's contained within inpatient nursing. Where it gets more complicated is maybe it's handoffs between nursing and lab and radiology, or maybe it's a transfer of patients between emergency room and nursing. You're now intersecting with other lines of business. In that sense, you need to have a broader group that's kind of involved in that decision process. It can't just be nursing making inpatient nursing making the decision for everybody, right? That type of consideration really kind of represents when an organization is clear on where those boundaries are and where the collaboration points are, it really empowers them to a systemic governance structure and a much more federated organization. I like to parallel that to something that everyone's familiar with is kind of just in our local government structure, right? There's cities, there's or it could be towns if you're in a smaller area, right? But there's kind of the local, which is your immediate where you live, either that city or town. Then there's counties, right? They work within the counties. There's counties, multiple counties make up the state, and then multiple states make up our federal government. In a similar way, you've got the individual line of business, et cetera, going up. But, where my town or city puts a stop sign, the state doesn't care about that. The federal government doesn't care about that. They don't need to be involved in that decision making, right? That's local to us.
Correct.
Versus if we're talking about a new road that's going between multiple towns and potentially going multiple counties, you now have to bring in more individuals into that conversation to actually evaluate what's right, make the right decisions. The budget is now cross departments, and so it adds to the complexity. And so I think that's a very much a parallel, but within an organization, it's a line of business, multiple business lines kind of collaborating with each other all the way up to the organization as a whole.
So as we talk about that sophistication of a federated model, uh, why are many leaders kind of afraid to make that? What are they afraid of losing in that transition from, local control to a more federated model?
Yeah, that's a really good question too. When I was thinking about this, it's really a matter of it's not the structure, right? When you go from local control to a federated model, already the level before a federated model is still a solid format of governance, right? You have to
Hmm.
have a solid element of governance and understanding, kind of
Sure.
putting the guardrails and everything before you can go to a federated model. So the barrier that usually happens between that governance structure to federated governance is really an emotional barrier. It's about trust. And so, the level of governance before federated is usually a centralized governance model. And so releasing some of that control to trust that the individual lines of business are gonna make decisions properly, that they're going to collaborate with each other when there's intersections between them and make the proper decision on behalf of the organization. Um, it's a trust component, really. And, when the organization again, this is where it's not just telling people this is how you do things. There needs to be an evolution in this so that people can build trust through that evolution. You can't just go from no governance straight to federated and it'll succeed. There's almost no way that that can succeed because you haven't addressed the process elements. You haven't addressed the confidence that everyone's collaborating and doing the right things and created the almost the genetic constitution of that belief or that systemic belief in how decisions are made. Because keeping in mind that, it's one thing to say that we take a federated approach. It's another thing for the people who are the recipients of those decisions to feel that that decision was made in the right way and to feel that they understand that process. And so the trust is not just at the stakeholder level, it has to be all the way through the organization that they know that, yes, everyone's keeping to the rules of the road. They're following those guardrails. There's visibility in the decisions and the decision rationale, right? They want to know that, I mean, I brought up the government elements, right? There's everyone knows those stories about, well, that person got that contract because they're so and so's friend or they contributed to so and so's campaign. We don't want that in governance, right?
Mhm.
So we
Mhm.
want transparency. We want clear rules on the guardrails, the guidelines on how decisions are made. And then also, we want to make sure that when decisions are made, there's a summary that's accessible to everybody, right? It's a quick decision, the rationale is documented, and boom, it's communicated, disseminated, and visible to the organization. That builds those systemic elements, those structural elements help to build that trust that allows the organization to evolve forward into that model.
So I'm sure for our listeners who might be in process of a transition from, complete local autonomy to that, federated model or that, mature governance model, um, are there any clues on how they might know the balance is off other than, you talk about the word trust a lot, you talk about
Mhm.
documentation of decisions and whatever. Are there any keys for our listeners to know if that balance is perhaps out of whack?
Yeah, that's also a really good one. When I think about it, it's if you start seeing challenges and fragmentation in decisions, if you start seeing aspects where decisions um, that impact other departments are the right stakeholders are not engaged, hallway conversations, if you don't see enough things being escalated to the right level. So if there's zero decision requests being brought forward to a integrated work group. I gave the example of inpatient nursing with ER. So maybe there's a level above the individual line of business there that's the clinicals, the hospital clinicals, right? Versus the rev cycle. And so the decisions, there's nothing being brought forward to the hospital clinicals group. And it's been several quarters since we've had any review at that level. That's usually a flag that you need to dig in. It doesn't mean that it's completely off because maybe there were not priorities that crossed over. That can happen. But if there's nothing feeding up at minimum to a monthly cadence, even a report out, there should be some level of report out or summarization of some of these decisions that are being made. Just for visibility again, I mentioned kind of that visibility and accessibility of decisions that are being made. So if there's nothing being brought forward to the higher groups, that's a red flag. Another red flag is the agendas for the higher groups are overflowing, right? There's like a backlog because there's too much
Sure, there
stuff
should be stuff that's
going. So now that's
potentially be brought back in
exactly.
locally.
So now that's an aspect of maybe there's a fear at the maybe there's a lack of understanding and ownership at the lower level where they're, like, in fear that maybe the other leaders are not gonna support their decisions, they're wary, and, that doesn't necessarily mean changing the structure, that could be coaching at a specific line of business. Hopefully, it's not all your lines of business. If it's all your lines of business, we definitely have to have a more systemic conversation there. Maybe they weren't ready to jump to the federated level yet, and how do we build that trust again? But I think those are the 2 extremes that are usually your biggest red flags is, nothing's feeding up or, too much is feeding up. And the measure of how much, it's hard to say because everyone's at a different maturity level. And so I would say that I have not seen organizations just dive into a federated model right out of the gate and just be like, this is perfect. There's usually some fine tuning as well.
Mhm.
Because you have
Yeah,
to
a little
find the
give and
right
take
level.
balance, yeah.
Yep. The complexity of each organization is different. So, like, I went straight from inpatient clinical, right, ER, inpatient nursing, maybe surgery, and straight to a clinical group, that might not be the right balance, right? In some organizations, they're much larger, and you might have to have, the ancillaries have a subgroup separated from the nursing flows. You might need a couple of extra layers in that federated model, depending on the complexity of your organization. So that refinement and fine tuning is an important piece to figure out how to find the right balance for your organization.
And I would think that, um, this isn't meant to feel like an acquisition or a purchase or a buyout. I meant this is about collaborative governance. This is about, well balanced and like decisions.
You're absolutely right. Governance is not meant to be a barrier to decision making. It's not meant to create a complicated layer that stalls action from happening. Where does work get done? We need work to get done, and so it's about empowering those at the level where work gets done, but being respectful that there are multiple. We talked about it last time on how complex healthcare is, right? The flow of patients, the flow of information, the dependencies, the upstream and downstream impacts in healthcare are extremely interwoven. And so it's not meant to create a barrier to work, it's trying to create an element to help unify and drive the decisions so that decisions can happen faster and help organizations kind of move faster for the transformation that they're trying to drive.
And for the ultimate, in the ultimate best interest of the patient,
Yes, absolutely. I mean, it all
sustainability of
comes
an
down to that.
organization and then the
Mhm.
patient.
It
Sure.
all comes down to that. It's the best interest of the patient, and I mean, sometimes people are like, "Yeah, but some of these decisions need to be for the financial viability of the organization," the finance world. But ultimately, when you think about it, a hospital remaining financially viable is
Is
for
for
the
the
best
patient.
of the patient, because if
Absolutely.
that hospital closes, that's a detriment to the community, that's a detriment to the patients in that community, and so, I always think about it like, let's follow that all the way through. Is we have healthcare deserts in our country, right? We have significant challenges in our country, and in order to, while some people, say, well, it shouldn't be making money, it needs to stay open. And so if a hospital or health system is not financially stable and financially viable, it's at risk of not staying open, and that is not good for any community, because that's where we then have major healthcare access issues, that then have actual patient outcome issues, right? So
Governance challenges are faced by healthcare organizations both on the acute side and the ambulatory side, as well as the specialty side, regardless of organization size. So, from rural health medicine to critical access to mid sized hospital to academic medical centers, including all those sub providers of care, whether those be um, uh, life flight medicine, whether they be ambulance transport, whether they be our payers. We all have a contributory component to governance, and the patient is at the core there. Are there things that a well federated or a maturely federated organization um, do regularly that maybe a struggling organization doesn't do? Proper grammar. Sorry about that. Mhm.
Um, yeah, when I think about it, I'd say the one thing that well-federated organizations do, that struggling ones don't really do well, is invest in that clarity. So it's more about clarity over control, right? So in a federated organization, I talked about kind of accessibility and visibility. So they define and publish that decision criteria in advance. There's Everyone understands that, whether it's tools to drive towards it, the expectations. I worked with, a large health system in Canada for a while, an academic health system, and I was really impressed with their governance structure. They actually created decision, review documents, right? So it's a little more complex than an SBAR, where it actually mapped out the specifics of the criteria. Is there a financial impact? What are the pros and cons? You have to list more than one option in here. What is the recommendation and what's the downside if we don't pursue this recommendation? So the options were expected to not even just say the risks and the challenges of option 1 versus option 2 if it's a technology investment or not. It was saying, what if we don't do anything? You had to include that in there too. What is the pros and cons of not doing anything? Um, and then in addition to that, it's taking that and making sure that the governance decision is documented. Really good, almost the core project management elements around, making sure you have good summary notes of what the decision was, and being able to explain no quickly though. So it's not stalling on a no, making sure that even if you say no, you have to explain the no. And that has to be consistently executed. And then it's making sure people have access to that, right? So people always knew the outcome. It wasn't just like the worst part in is that or what creates distrust is when people don't have visibility because then the rumors start, right? It's, oh, well, that was because so and so presented it versus, I don't have the political clout or whatever.
Right,
Having
they
that
made a
full
decision for me. I'm being
Exactly.
told.
Exactly, and so and sometimes if it's not able to be made a decision right away, being very clear that you didn't complete the requirements properly, right? Did you
Mhm.
talk to these other departments? That's a part of the requirement. It says one of the clear things is, does this impact anyone else? Did you talk to those other people, right? And so I remember when I first engaged with that organization, I was like, wow, this is a lot, a lot to create your decision request. But at the same time, I realize over time and working with so many different organizations how valuable that is.
Mhm.
It really makes it clear. It really makes sure that everyone's on the same page and understands that. And it really builds that trust and allows and protects the trust so that the trust doesn't erode over time.
And I think, when you are clear and you do share and people understand the why,
Mhm.
um, organizationally, you can have much more success. Again, there's a lot less pushback to decisions that are made because people understand the why. Uh,
Absolutely.
so,
Absolutely.
before we kind of move to the last topic of the day, I wanted to just ask, if we look at the governance maturity ladder in general, where do we think most organizations are sitting? Does it differ by, is it stratified by size of organization? Is it stratified by um, areas that have a high concentration of healthcare, or is it pretty standard?
That's a really good question. I would say, just kind of really summarizing the maturity ladder really quickly before I specify kind of where I think most organizations are today. So the maturity ladder is traditionally 5 levels. Level 1 is pretty much you don't have governance, which is ad hoc heroic decision making, right? Level 2 is kind of that emerging governance. You kind of start creating some committees, but enforcement is inconsistent. So there's not like a regular what we were talking earlier, the trust is not there because it's not consistently executed. Level 3, you start having structure, you have control, you have definitions, but it tends to be centralized, so it's a little bit slower. It maybe a couple of governance elements, committees, and everything has to feed directly into those, and so very much more centralized, but slower. Level 4 is the federated model, and so very integrated, right decisions at the right level, local authority, everyone understands where they can make the right decisions, and it manages really well with not every decision having to reach the executive level. Most can be done before that. Level 5, I don't typically see in healthcare. It's called optimized or strategic. This is where governance is completely cultural, adaptive. It's part of everyday breathing. Everyone understands the strategy, and this is just second nature to go through the right steps, engaging the right partners through that process. I don't think there's a lot of organizations in general that have that level, but that's almost like the utopia of governance. I would say in healthcare, I am starting to see some organizations, a decent number that are in the federated mode. It might not be a complex federation because they're still within federation. You can kind of debate how many committees is the right number of committees.
Mhm.
But it does get a little complicated as we get more initiatives out there with cybersecurity challenges and AI and everything else. That some folks start standing up separate committees and pathways down those roads instead. I would say there's quite a number of healthcare organizations that are level 3. I think the centralized components of it, at minimum, having even rural hospitals, right? At minimum, have that executive level, right? So most organizations have at minimum that executive governance. And there are a lot of organizations that understand standing up a project, especially a significant project like a electronic health record or ERP, bringing up a governance specific to those projects, right? Um, I would say that the consistency level, though, is still a challenge. So knowing that most hospitals and health systems in the US that, it's about what, 67 or 68% of the hospitals in the US are less than 100 beds. So in that mindset, I would say we're somewhere between 2 and 3 for most organizations. When you start getting to health systems and stuff, you're between 3 and 4. And some of them in 4 are getting very advanced in their level of kind of dynamic complexity in their federated system. So,
Hmm, fascinating, fascinating.
yeah.
Yeah, thank you for that. I was just curious again, we have healthcare from east to west, north to south, when we're everywhere. And as you said, we have droughts in certain areas and overpopulation in others.
Yeah.
But it's interesting to think about. Well, today, as we wrap up our conversation, I want to move into something that I know is increasingly occupying most leaders' times, and that's related to our vendor partners. As they start to embed analytics, automation, and AI into their platforms, we're starting to test governance in new ways. Um, how should we look to see the governance model evolve when the major vendors now are long-term strategic partners rather than just somebody who supplies us with something transactionally, whether it be an advisory service or whether it be a J wire for a cath lab?
That's such a great question, and it's, very much something near and dear to my heart now. I think, Patty, you know already, I since our last recording on governance, I've started a new position, and so I've joined the vendor side of the world for the first time in my career. I've been on the consulting side for many years, and so having to think about it from a digital health tech perspective, I love the lens I come with, having been on the provider side and helping providers think about buyer decisions for many years. I think I would frame this in 2 categories. I'll think about the relationship component in that partnership, and then also there's this aspect of kind of AI, and there's this term that's starting to emerge more and more around AI governance, like what you were inferring, the embedding of AI, governance into the AI and the technology. So first off, with the aspect of the relationship and the partnership, it's I think there's an element within the vendor world for many years that, when an organization has a strong governance structure, there are some vendors that kind of fear that, right? And they think, "Oh, maybe that's gonna be a really long sail," right? Because we have to navigate this complex world of all these different committees and all these different, decision makers. They might not be the only buyer, they might not be the official buyer, but it has to go through all these hoops in order to get there. And I think the biggest part of that is vendors need to understand that governance is not a hindrance. It's not meant to be a barrier. It's meant to clarify the risk, the technical fit, and the value for the organization. So, as a vendor, it's really important to invest your relationship time in understanding that governance web and not trying to just be like, oh, I'm going to bypass it or what's the fastest way around it. Because if you go through and work with an organization that has a mature governance, working with the governance structure and working with your stakeholders and buyers to navigate that actually creates speed later. So it actually means that you're not gonna have as much rework. You're not gonna have as many of the challenges and scope issues, the reversals, the stalled adoption, because everyone has gone through it and the organization understands it. And I'll give an actual example. One of our account reps, I've been very impressed with how he navigates one of his big customers. I watched him kind of really do this where he didn't fight the governance. He understood that this governance is really complex. It's a large integrated delivery network. So you got both the health plan side and the provider side and thinking through this. And when we were working with him on this, I love that he spent his time investing in understanding and building his relationship across not just IT, which some tech companies do. He thought he knows his right players and his right relationships within the tech side, within the AI governance team, within the operational leaders. And what that allows us to do is depending on the solution, he pre-vets things before even getting to business because he knows business has to drive the decision on whether this is the right thing because it has to fit the needs of business. But he also knows that business isn't going to move forward unless IT says, yes, this is a legit platform. Yes, the AI governance says this meets our criteria for strong AI. And so with those conversations, we had the right meetings with the right players. And then now we're in the deep conversations with business because we were able to qualify our capabilities for business. Now we're able to dive super deep into what are the challenges that you're trying to do? What's that strategic roadmap? How can we help you with even potentially accelerating accomplishing your strategic roadmap because of X, Y, and Z within the technology? So it's really powerful when you're able to do that well. And I think that's an amazing thing. Um, I think I wanted to circle back also to that distinction on AI embedded governance, right? And I think of it as kind of it's really a matter of the technical governance. What is AI doing? It's able to read your policies, so you could actually have AI help your actual governance process with
Sure.
policy evaluation and making sure things are complying to the guardrails that you put in. But when you actually implement AI as well, there's an embedding governance that you need to do that's a technology component to make sure that there's guardrails around the technology, that it's meeting your cybersecurity needs, it's meeting kind of your expectations around controlling everyone knows those fun words in AI around hallucinations and bias and things like that. So you have to make sure that you're creating the proper governance in the platforms or in the tools where AI is behaving. So I think of it as platform governance manages how AI behaves, but organizational governance decides whether and where AI should be used. So that's how I think of it specifically in AI.
Yeah. Again, I can't thank you enough for joining us today and, bringing your perspective. Now you have it both, you've got the strategy, uh, and the technical and the all sides of it now. You're surrounded, you've experienced it from all sides. And, I look forward to expanding our talk, particularly in that AI space. This is a topic that's so often misunderstood, or we politicize it, as we talked a little bit. We link it all to the government, or we just tend to avoid it and not take care of it. Um, you know, e effective governance, what I've learned today and what I learned from hearing from you is not about control, but it's about, you use the word over and over again, trust and clarity, um, disciplined decision making. And when governance works, as you said, we can move a little faster, leaders feel supported, we can actually make um, quicker decisions, teams understand the why.
Mhm.
They're not just acting because somebody told them to. They understand why we're doing what we're doing. Uh,
Absolutely.
for our listeners out there, we really hope today that you see governance not as an obstacle to transformation, but an enabler of transformation. Allow the governance to work in your favor and help you transform your organization and take it to the next level. Um, Madeline and I really appreciate you taking time and spending it with us on Avarian Insights. We hope this conversation resonated with you. We hope you'll continue to follow the podcast and explore how strong governance, thoughtful strategy, and a clear decision structure will help your organization navigate the complexities, and can drive meaningful change. And again, Madeline, I can't thank you enough. And for our listeners, until next time, um, keep asking why, and remember, better decisions build stronger systems. So we thank you, everybody.
Thank you.